I switched something up. Can you guys still hear me? Thank you.
Tara, can you hear me?
Yes.
I just want to make sure I'm saying Tara. It's Tara, right?
Yes. Yep, you got it.
Thank you. Good morning. Welcome to the Special School District's Lunch and Learn series. We are super excited about the opportunity to learn together. Today, we will be learning with Tara Stevens from Behavioral Health Response. Tara Stevens will share some information about their organization, their services and programs, and how these services and programs might assist our students and population and communities. We welcome your questions and your participation. We will have a Q&A session immediately after the closing of the session. However, we ask that you do not disclose any identifiable details or confidential information about a child or student. This forum is open to the public, meaning it is not private. We ask if you have to leave before the session is concluded or would like to share these contents with others in the future, please know that the recordings of this presentation will be available on the Special School District YouTube channel. Following this presentation, we will introduce you to members of our staff that can help to support you if you have any additional questions or needs. Tara Stevens, we are so happy to have you with us today. And I am going to stop sharing my screen and you can share yours.
Okay, great. Thank you so much for inviting me to come in and talk with you all about BHR, Behavioral Health Response, who we are, what we do in the community, and how we might be beneficial to you. So this presentation usually is about 15 minutes. If you do have questions, feel free to put that in there and we can answer those at the end. So this is my contact information. If you do have additional questions or concerns, feel free to reach out to me and I'd be happy to provide some follow-up. So BHR stands for Behavioral Health Response. We've been in the community for about 27 years. So we are considered the crisis line of the eastern region of Missouri. We cover about 10 counties: St. Louis City, St. Louis County, St. Charles, Lincoln, Warren, Franklin, Jefferson, St. Francis, Iron, and Washington counties. So anyone in those 10 counties, they can call and reach a mental health professional 24/7, completely free of charge. Okay, so we like to consider ourselves kind of the safety net of the Eastern region. We've been around for 27 years. We were founded by the community mental health centers in the area. They got money from Department of Mental Health to have a line where their clients, if they needed to reach a mental health professional and it was after hours, they could call and still get that mental health support, because crises don't just live during work hours, right? They're all the time. So that's how we were founded, but we have grown since then. So in addition to our nonprofit side, where we provide that 24/7 crisis intervention, we also have a for-profit side to help pay for the nonprofit services. So we have contracts in different states, working with EAPs, substance use lines, doing telehealth in hospitals, a bunch of different things so we can help provide these free services for individuals in our community. Having said that, we have heard and seen everything. So I always tell people, you're not going to call and like shock us and surprise us. And even though we are the crisis line, you do not need to be in a crisis to call us. So everyone always thinks, oh, I have to be thinking about suicide if I need to call the crisis line. And that's not true. We do have people who call us because maybe they are thinking about suicide, or they're having thoughts of suicide or harming somebody else. And calling BHR is completely appropriate. But we also have individuals that call us because they notice behavioral changes in a loved one and they don't know how to provide support or help, right? They may call us because they're trying to navigate the mental health system and they don't even know where to start, right? It's overwhelming. What counselors do you call? What psychiatrists do you call? If you call, is there going to be a huge wait list, right? And so you can call us and we can help you navigate that system. We have a huge database of resources and we know kind of what areas maybe take certain insurances or do sliding scale or provide free services. And we can kind of help direct an individual to get that support that they need. People also call us because maybe they are just really stressed out and they need to talk to somebody who is not related to them, right? Who's not going to have any judgment or any biases based on what this individual is sharing. So really, like I said, no wrong reason. I passed out this gold card to so many individuals out in the community. And I always say, you never know when you may need it, right? I had one lady tell me that she would pass this out to clients of hers all the time, this gold card. And one day she was driving down 70 and she started having a panic attack and she pulled over and she called us. She used that card, right? You never know when you may need to talk to a mental health professional, and knowing that you do have access to one 24/7 completely free of charge is huge, right? So we want to make sure we have that number available, not just for us, but if we're around somebody who does need it. So this is the card that's for any age in those 10 counties that we serve. I've seen a 2-year-old, I've seen a 102-year-old, right? You can call us and talk about whatever you may need to. It's a very organic conversation where we let you lead it. We always address safety concerns though. So we're always asking about suicide ideation, homicidal thoughts, self-injury, because we need to make sure that you're safe. We can't provide support and help for you if we're worried about your safety. That's our number one priority. And so we're always going to address that, but then it's going to be very organic. It's not like a checklist that we're going through, right? We want to make sure we're getting that support that you need in that moment. So you can call us on the phone and talk to us. This is if you're calling because you're personally wanting to talk to a mental health professional, or maybe because you're calling about an individual that you're concerned. Like I said, we have parents, we have school staff calling because they may have concerns about a child's behavior changing, right? This has been a super stressful time for us in the past 2 years. And as adults, we are experiencing the stress, and kids are not immune to that. Students are not immune to that, and they're experiencing stress as well. And so we're seeing some additional anxiety, depression, some symptoms coming up, and adults and staff, school staff and parents are recognizing this in students. And so they're calling and reaching help because because they don't know how to provide that support to those students. So this is the card. Anyone, any age can call us 24/7 and get that support over the phone. In addition to that support over the phone, sometimes our clinicians feel like it might be beneficial to see that person face to face, right? Kind of provide a little additional support in that moment. And that's when we will send out our mobile outreach team, what we call our MOTs, where they will actually go out into the community. This is always changing because of COVID restrictions, right? We're always going to make sure that everyone's safe involved and take precautions, safety precautions in that way. But we can come out into the community, whether that's a school, whether that's a home. I've gone to park, I've gone to McDonald's, wherever somebody feels safe, and we can see that individual one-on-one and do what we call a crisis assessment form. So this is when we're just talking again organically, but there are additional things information we are trying to gather. So we're going to look at safety concerns as always, but we're also going to ask questions about mood, anxiety symptoms, trauma history, substance use. We're trying to get like an overarching kind of view of what's going on and how we can provide support for that individual. So if you call us and after talking for a little bit on the phone, we decide that you benefit from a mobile outreach, then we will dispatch those MOTs, and they usually arrive on scene within an hour and a half from that phone call, give or take, because we are in those 10 counties. If an MOT is in a different county, it may take longer. It may take longer during different times of the day with rush hour traffic. But we typically like to be on scene within an hour and a half. So right away, you're not waiting a long time for mental health professional to be out there. And then we talk, and this crisis assessment form, like I said, we're asking those kind of overarching questions, and it usually takes about an hour and a half. And then we come up with a plan together. Right? You know your body best, you know what's going to help you. And so we're working as a team to figure out how best we can provide that support. So is that getting you what we call a next day urgent appointment, an NDU at the local community mental health center in the area, which would be BJC in St. Louis County? We can actually get you an appointment within 24 or 48 hours to be seen and see if you qualify for their services. We can even provide a cab free of charge. We don't want transportation to be a barrier. So we can provide a cab to that initial appointment. So we make sure that you are getting screened and see if you qualify for their services. But like I said, we have this huge database of resources. So we will also kind of look and see what other agencies in the community would be beneficial for you. And we're going to come up with a plan on how to, if we're going to make a phone call with you to schedule an appointment somewhere else, whatever that may look like, we'll come up with a plan. If we come out and we do see you, or you are under the age of 19 in St. Louis County, then you automatically get enrolled in our follow-up program, where we have an awesome team of follow-up clinicians that will call you within 24 hours of our initial interaction, either if that's over the phone or mobile outreach. And then we will call you weekly, more or less, depending on your need, until you're connected to services. So we know when we're overwhelmed, right, and we're trying to navigate this mental health system, it's confusing and overwhelming, right? When I've been mentally healthy and I'm trying to navigate it, there's so many phone numbers, and you're calling providers and they don't have, their wait list is like 6 weeks, or they're not even taking individuals, or now they don't accept your insurance, whatever it may be. It's overwhelming. And so our follow-up staff actually is so great, because they work with you. They can do 3-way phone calls to get you an appointment. They also really know, because this is what they do all the time, they know where there's waits at different psychiatry offices, right? They know kind of who's taking what insurance and how long those waits are. And so they're really able to help navigate that system. We want to make sure that you still have somebody that you can talk to while we're getting you connected to that long-term care, which is the ultimate goal. Right. So this is the card for everyone, but in St. Louis County, we actually have a youth connection helpline. So this money is, there's money actually funded through another grant, a sales tax increase in the county, that goes to youth mental health services. So these services are available free of charge. Some of them may have a sliding scale or a small fee, but most of them are free of charge. For anyone that's 19 and younger in St. Louis County, and anyone in the city who's 18 and younger, and then anyone who's 18 and younger in St. Charles County. So there's a lot of different funding resources that go in this Youth Connection Helpline. What I love about this youth line is that in addition to calling, youth can also chat online, or they can text us, because we know youth nowadays, maybe they don't want to call and talk to a lady my age in the contact center, right? Maybe they want to chat through online or through texting. And so this gives them an opportunity for that outlet. I want to make sure you know, whatever card you have, both of them will work and they reach the same people. We just like passing out this youth line because it does have that chat and texting feature. In addition, it has that Safe Place logo, which I'm sure you've seen out in the community. It's on quick trips, metro buses, libraries, fire departments. The Safe Place is for individuals who are not feeling safe at home. Maybe they need to go somewhere just away from the stressors that are happening at home for a period of time. For any reason a youth is not feeling safe, they can go there, let the individual know they're there because it's a safe place. They will then call us in Youth in Need, and we will make sure that that youth gets that support that they need in that moment. So these are our cards. If you are interested, if you need some of our cards to pass out, either the gold cards or these green cards, down at the bottom, you can email resources@bhrworldwide.com. Just put in your information, how many cards you're looking for, and then your contact where we can mail them. Okay, so the address to mail them. But we would be happy to send these cards out, so you can just pass them out. I always say pass them out like candy, because again, you never know when it might be beneficial to have this number, either for yourself or to pass on to somebody else. In addition, we have this Youth Connection Helpline sheet that has some additional information and kind of just overview of what I just mentioned. This is going to be available to you through your school social workers and also through the school's Peach Jar accounts. So you'll be able to access, and this will just give you a little bit more information of who should call this youth line, what is the contact information, and how we can help. If you are looking for more information on BHR or looking for cards, or you're interested in trainings, because I do come out into schools and provide trainings on emotional regulation for students, suicide awareness and prevention for students and staff, and trauma-informed care for staff, you can go to bhrstl.org. And you can go up to the button where it says contact and scroll down, and you'll see this become a partner. And this is where you put in your contact information and then put in whatever request you have. So if you want additional information on trainings, you can put that there. If you're looking for our gold cards or our Youth Connection Helpline cards, you can put that information in there. Again, just how many cards you're looking for, and then an address to send them to. So I want to talk a little bit about what our outcomes are when individuals call the crisis line. Majority of the time, we're able to connect them to a community agency, right? We're providing that link. Maybe they're just looking for services. Maybe they're calling and after the crisis is kind of resolved, they're looking for counseling, psychiatry, substance use treatment, respite care, whatever that may be. We can provide those referrals or get them connected again to their existing provider. Like I said, crises don't just run from 9 to 5 when places are open, right? And in BHR, we like to consider ourselves the safety net of the Eastern region. So even if you're already connected to a psychiatrist or a counselor and something's going on in the middle of the night, or something's going on the weekend or a holiday, know BHR is here and we can provide that support. 6% of the time we're sending out those MOTs, those mobile outreaches, where we're actually coming out into the community. 1% of the time we're creating that NDU, that next day urgent appointment at the community mental health center in the area. So you can see kind of overall where we kind of direct and how we provide support to individuals who actually call us on the phone. And then for mobile outreaches, you can see, again, majority of the time we are referring to community agencies. That's when we're coming up with that plan where we're providing those resources to counseling, psychiatry, substance use, any different services in the community that individual benefit from. We're providing those phone numbers, calling, making appointments. And then about a third of the time, we're providing those next day urgent appointments. The goal is to get an individual linked to the ongoing support that they need. And what we know is when someone's suicidal, it's not necessary that they need to go to the hospital all the time, right? Sometimes we have to go if we can't keep an individual safe, right? We do have to ensure they stay safe, but most of the time we can come up with a plan to keep them safe and to keep them in their home while we get them connected to that mental health support, that long-term care. So somebody who calls us because they're suicidal, it doesn't mean we're automatically going to be like, we need to go to the hospital. You can see from our mobile outreaches, which we usually do about 350 a month. You can see only about 13% are we actually going to the hospital. And if that's necessary, our MOTs will go to the hospital with you and kind of walk you through what those steps are going to look like and provide that support to the family as well. All right. Again, there's my contact information. If you have additional questions or you're looking for additional resources, feel free to reach out to me. Does anyone, I guess I'm going to stop the share and then see if anyone has any questions.
Okay, Sarah, that was very, very helpful. Thank you. We do have a couple of questions in the chat. One question, because many individuals have a comorbidity of a disability and a mental health condition, are your clinicians trained to assist these individuals?
Yes. Yes, we are. And I would not, that is a concern for, I know for a lot of callers, and I wouldn't let that hinder calling us by any means, because our clinicians are trained.
Okay, and then there's a follow-up question. Do you have any resources within your database that can assist individuals with a disability and a mental health condition?
Mm-hmm. We sure do. Yep.
Okay. And then we just got another question that came in. Are assessments done in person or via Zoom?
So that's a case by case, and depending on what restrictions look like, safety concerns are. So again, we would just have to kind of evaluate that when an individual calls and kind of figure it out. I know that sometimes we're able to still do face-to-face, but keep distance, do outside. But it just depends on a case by case basis.
Okay, and I'm thrilled that some more questions are coming in. Are you aware of therapy resources funded by the St. Louis County Children's Fund that have short wait lists?
Okay, so that is, we are funded through the Children's Service Fund, right? This is the Youth Lines funded through that. And we are able to get youth linked within 4 weeks, I think like 67% of the time. And the biggest barrier is parental consent. So we are able, like our follow-up clinicians know, if you call and you're calling about a youth, you automatically go in that follow-up program, even if we don't do an outreach. So our follow-up team does know, where what wait lists there are in certain areas, and they'll navigate that for you. So they're up to date and they're awesome at what they do. So they'd be able to provide assistance.
And then the person who asked that question commented that Family Solutions has a long waiting list.
Okay. So I would reach out to us and we can see how we can navigate and maybe look at additional services in the area.
Okay, and I just might ask our viewers if they have any other questions. Okay, I don't see any other questions coming in. So Michelle, I will turn it over to you.
Thanks, Sally. And thanks so much, Tara, for sharing your time and for all the essential information and resources that you share with our viewers today from your organization. I like that phrase you said, you know your body best. And that is so true. We know our body best when we're in a crisis mode and what services we need. So thanks for sharing that helpline information as well. At this time, we would like to introduce individuals within our own school district who can also assist to connect you to community resources. If you would like to unmute yourself, Emily.
Hi, guys. I am Emily Lebu. I am a liaison here at Special School District in the Parent Education Department. We can help you navigate through various community resources for various disabilities, social, emotional, educational. We are able to partner with our community agencies and get you all the help you need and point you in the right direction. So just let us know. You can call us at 314-989-8460, or you can find us on the SSD website under the Parent Education and Diversity Awareness Program.
All right, you want me to go, Michelle?
Yes.
Okay. My name is Meg Lavera. I am one of the 2 technical administrators here for the social work department at SSD. We have over 100 social workers within our department that service all of St. Louis County. We can help assist with getting you connected to one of our SSD social workers as appropriate, who can always help navigate these resources. One of the questions I had that she already answered was, how do we get more cards? Those gold cards are amazing. So I will definitely be hopping on and requesting some more of those to give out to our folks. So if you have any questions, you can reach myself at 989-8444. Jennifer Beavers is the other social work EPS, and she's 989-8242. So thank you.
And I am Michelle Franklin with Family and Community Outreach. I am happy to assist anyone in serving our students and families countywide. Most of the time, I am located at Central Office. However, oftentimes I'm in North County at North Tech High School as well. You can reach me at 314-989-8034, or you can reach myself and my manager, Adrian Eaglin, at Family Engagement at ssdmo.org. Again, Tyra, we want to thank you for all of the information you provided us during this session for our viewers, for our district, family, and community. It was really beneficial. We learned a lot, and I'm looking forward to seeing the cards, the helpline cards in our spaces, more in our spaces. And I see from the questions and all of that, a lot of our viewers have great need for your resources. So thank you so much. And do you want to add something? You want to say something to our viewers before we leave?
Oh, I just want to say thank you so much for inviting me, and be sure to pass this information on to anyone you think might benefit from it. It's been a hard 2 years. We all need support, and to know that you have this this number for you available 24/7 to reach a mental health professional completely free. I think we all need that information at some point.
Thank you. I agree. This concludes our presentation for today, and I would like to thank everyone for attending. Have a wonderful rest of your day.